A big question out there that I hear all the time is marijuana. Marijuana grows and marijuana in general. Let's look at marijuana as it is for the federal government. It is an illegal drug. Let's look at marijuana as it is in the state of California. You can have it for medicinal purposes. So it has two spectrums here. Which spectrum do you sit on? I guess it really depends on your medical needs. Marijuana as in general, we need to look at it, let's say on the pharmaceutical side, because the state of California has says marijuana is medicinal. There's 19 other states like the state of California that have voted that in. There's 13 states going through litigation if their bill passed regarding medical marijuana. There's 2 states in the union that already say marijuana is okay to have as recreational drug. So let's take that aside and just talk about Tulare County, the 5th District, and the Central Valley in a whole. If we were to implement and use marijuana ordinances to use them more as a pharmaceutical company comes into compliance, then maybe that's the way we look at it. To maintaining that if you're growing an illegal drug, you're doing an illegal activity, let's keep the pressure that way. In particular areas where somebody has followed the letter of the law and we've given the ordinances to provide medical marijuana, then let's give them the tools that they can work with. One of my ideas is to look at is putting ordinances in place where you could have, let's say, a industrial area where it allows marijuana to grow, but that marijuana needs to be grown in a confined area, in a building, a large building. But we do have rules and regulations in place regarding pharmaceutical companies. Pharmaceutical companies can come into play regarding this growth as long as it's legal. Who am I to deny someone their medicinal need, whether they be a cancer patient or whether they be someone whose joints are swollen because whatever scenario may happen to them? This is what I commonly hear. It's my joints, it's my aches, it's my pains. It's a cancer patient. Those are the folks that are in dire straight needs. Those are the folks that want that marijuana. It could be a 3-plant, 5-plant ordinance, but it has to be a uniform ordinance between the cities and counties. It has to be a uniform ordinance between all of us. So no matter where you're at, we're able to say this is the ordinance. Just like traveling on 65. You travel 65, you know some areas it's posted out there 55, 65 miles an hour. 75 miles. We understand what the speed limit is. If we go faster than that, we know we're breaking the law. The same scenario says this is a straight across ordinance that everybody came into compliance and say, cities, 3 or 4 plants, there you go. That's your ordinance. Marijuana grows outdoors, not allowed. Marijuana growing in a confined place in industrial areas, that is allowed, along with the process of someone going through, once again, the pharmaceutical companies have certain things in place. Let's look at the process, let's work through the process, and make sure that everyone is following their order. It's a lot easier to maintain when we all know what the law is. It's a lot easier to follow up when we all know what the law is. Right now, we've convoluted the law between pharmaceutical and illegal drugs. Let's first of all keep the drug cartels out of our area, whether they be from Mexico or Colombia or whatever they may be. Second place is let's take care of the folks that say this has helped me because of my ailment. Who are we to deny someone their medicine if it's proven? Who are we to deny that if that releases that pain or provides a cancer patient the availability to eat a little food, a little better, and maintain their growth? Let's work together collectively, counties and cities, to come up with ordinances that make sound sense, common sense, as you might say, for all of us, for you and me, your neighbor, my neighbor, that we can live together and provide the relief for some of those folks that need it.